at Harvard University, two scientists and also dermatologists found that, Coolsculpting came from that cold. They found that the cold can basically affect and eliminate fat cells without damaging the surrounding skin or tissue. So they named this term this popsicle paniculitis. So, I apologize for this picture, but I think it says a lot that they started about in 2008 with the animal model. So they basically just used a frozen plate, exposed it to this area on, this is actually pig skin, this is actually what probably bacon looks like. So if you see the area that was treated 90 days post-treatment with this fat cooling device, and you can see the control area, which was not treated, and then the area that was treated, you can see the difference after 3 months that it reduced the amount of fat without damaging the surface skin on top. So, now we know that Coolsculpting has now been around since 2012. It's FDA cleared. It is non-surgical. There's no incisions. There's minimal downtime, and it's really good for areas like, your abdomen, either upper or lower, areas under the chin, the upper arms, the thighs. There's a lot of, over 100 publications, and around over 200,000 treatments are done per year. So we are very fortunate to have these devices, not only at our main campus, but also in Avon. So let's go in a little more to the science, how exactly it works. So a lot of us have stubborn fat despite diet and exercise. So these little yellow globules are just depicting fat. Coolsculpting technology basically uses cooling to target and kill only the fat cells. So it doesn't eliminate all of them, but anywhere from like 25 to 30% of the fat cells are permanently removed after one session. And then in the weeks to months after the treatment, the body naturally processes fat and eliminates the fat dead cells. So at the end, you'll find that there's a permanent reduction in the amount of fat cells, and it stays that way indefinitely. However, usually depending on the area, the amount of fat there is to begin with, some people may require more than one treatment. However, the fat cells are permanently gone, which is wonderful. So it's important to know that, before this treatment, we have, fat that's evenly distributed, and the number of fat cells is actually set at adolescence. So after Coolsculpting, we don't eliminate all of them, we just reduce the number, and they're kind of redistributed. So, if you treat the abdomen, you will have less fat cells there. So if you gain weight, you may gain weight all over, but you may gain less weight or notice less fullness in the areas that have been treated with Coolsculpting. How does it work? So, up to 25% reduction, it visibly reduces the fat layer thickness after a single treatment. So basically this is pinchable fat. So, our kind of joke or phrase is if you can squeeze it, you can freeze it. It's important to know that Coolsculpting is not meant for weight loss. People lose inches and not pounds. So you'll find that your clothes fit better and you might have a better shape, but you're actually not going to lose weight on the scale. It's also important to note that the ideal person for this are those at their target body weight, whose BMIs are normal. And it's really meant for areas that are stubborn for diet and exercise. It definitely does not replace exercise or diet, or, it's not meant to mimic liposuction. So we have FDA clearance for 8 areas of the body, which is the most out of any of the non-surgical fat reduction technologies. And now, this slide is a little bit outdated. It's now we have 10 years of long-lasting results. So how long does it last? Basically, the final result you see at 3 to 4 months after the treatment, but many people notice improvement sooner. And once the treated fat cells are gone, there's permanent destruction. So as long as you maintain your weight with diet and exercise, the results are permanent. It's also important to note that, over time, you might find that, as long as your weight is stable, that, these are long lasting. So initially you could have a little bit of downtime after the treatment, but once you hit that 3 to 4 month mark, you're seeing the final result. So, at the consultation, we basically, we look together and to see the areas that you're bothered by and come up with specific goals. We do mark the areas to be treated and we do take photos. Depending on the area that gets treated, it's anywhere from 35 minutes to an hour. And, that really just depends on what area you're targeting and how many treatments you want to do at one session. So we're very lucky that we have several different applicators. This is just to show you, we have tiny ones on the left, like this is what we call our Cool Mini for the chin region. And then we have ones in between, like the Petite we use on arms, the Advantage we use on abdomen, and the Advantage Plus is the largest one we're using, if someone has, a larger abdomen, either upper or lower, we can use that to, to target a large amount of fat. So these are the areas Coolsculpting is FDA approved for, and it kind of shows you some before and afters. So we have the submental region or under the chin. You can see it's definitely not perfect, but way less fullness. This is 12 weeks after a session. This stubborn area, the bra fat or this bra bulge in front of the arm. The abdomen is probably the most common. We can target upper, lower, all over the abdomen. Inner and outer thighs can also be targeted. We can do the upper arm, the flanks or the back fat area, the love handle region, kind of on the sides, under the buttock, which is the banana roll, and then the outer thigh. So we do take photos before each treatment. And then, afterwards, we also take photos. So it's a nice way to follow improvement throughout your treatment. So essentially this external applicator is placed on your skin, and the fat is actually super cooled or frozen. And it's best for people who are ideal body weight with stubborn areas despite diet and exercise. It's really non-invasive. There's no, breaks or anything in the skin. Each treatment takes anywhere from 25 to 45 minutes. Pain is minimal. I tell people it feels like, you worked out too much, or maybe your muscles are a little sore, but it's really minimal recovery. You have no activity restrictions afterwards. You can sometimes have some swelling and bruising, but it's really, it won't impact your day-to-day life. And it may require 2 to 3 sessions, depending on what the goals are and how much fat you have before starting. So the day of treatment, it's really nice. You can, you can read, work on your laptop, relax. Some people take a nap. As you can see in the picture, the applicator is applied to the targeted area. The tissue is drawn into a vacuum cup. So at first you feel a little cold, and then basically the cooling is delivered to the targeted fat. Interestingly enough, afterwards, it really, what we describe as like a frozen stick of butter. So this was a patient I treated. You can see on the abdomen, this was the max or the large applicator. It looks a little funny, but the skin is completely intact and just the fat is completely frozen. There is some redness and swelling. If you take aspirin or ibuprofen, you can get some bruising. And really afterwards, there's no restrictions. We do a gentle massage and then the skin really goes back to normal. And it's a little red, little swollen for a few days, but it's really tolerable. This is just some other pictures. Right afterwards, we take off this applicator and you can see, we use what we call a gel pad. This comes off of the skin. We have our markings here, and then this frozen stick of butter. This is once again that large applicator on the abdomen. So now that we've heard about it, let's talk some statistics. So in 2018, almost 287,000 treatments were done. So that number keeps going up each year. And now we're in year 10 of having this FDA approved. I'm sure all of you are curious to look at some results. So these are just showing, these were actual patients that were treated. This is the abdomen. So before, this was 8 weeks after the first Coolsculpting session. So this circle here shows that large max applicator. This was after 1 session. And then she wanted a second session. So now the upper and lower abdomen were treated. So in total, she had 3 cycles. So the first time she had one applicator and then 2 afterwards. So this is a pretty, real life example. Once again, looking at the abdomen, this patient had, she had 1 max on top, so a large applicator on top, a large on the bottom, and then 2 kind of on the sides. So this was 8 weeks after a session with 4 applicators. Another abdomen. So this person, sometimes they don't have enough fullness to treat with a large applicator. So there was kind of a diamond plan, 4 smaller applicators done around the abdomen, and this was 16 weeks after or 4 months. And then we also do it on men. This is actually a relatively common treatment on men, doing the abdomen and the love handles. So the large applicator on the bottom and then 2 on the sides. This was a great result after 12 weeks. Another gentleman had the smaller applicators kind of to sculpt the lower abdomen and the flanks. And this was 6 weeks after. And he did have, 4 applicators in total. And then the back. So a lot of women are bothered by like that bra fat or back fat. So this is a great option, for that pinchable fat here. This was just 13 weeks after 1 applicator to each side. So nice improvement. As you can see, better contour. It looks smoother. Clothes fit better. Once again, the back. This is, several sessions to the upper and lower back. Can make a nice contour. People definitely notice their clothes fit better, and they might even notice that they're a few inches smaller. And then once again, on the flanks, 1 on each side. And, as you can see, everyone has improvement. It's just a matter of how many sessions and how much improvement people get per session. The one nice thing is, as long as you don't have loose skin at rest, there's really no skin elasticity or, loose skin after the treatment. So for younger people, this is really a great option, just to reduce that pinchable fat. This is under the chin. This is a great option to improve that angle under the chin. We call this kind of the cervical mental angle. We know over time some people can accumulate fat here, even if they're otherwise, normal, healthy BMI. So this is the Cool Mini is a great, this was 2 sessions, 2 applicators. 8 weeks after that. And once again, this was someone who had 2 sessions under the chin. You can see, her face looks thinner, better angle overall, and just, really nice improvement. Again, under the chin, this was 2 treatments. So, this person had a little bit of loose skin at rest. So most people would agree that this looks better. So there's less fat here, but sometimes you can have a tiny bit of loose skin after the treatment. And then this was a gentleman that had his chin treated. This was 2 sessions under the chin. The arms are a great area, kind of that, that loose fat. And we put the applicator kind of right in the underarm so we can treat this area of fullness right here. This was 8 weeks after 2 sessions. Same thing here. You could definitely notice less of a bulge, less fullness of the arms. And then when we do thighs, sometimes thighs are a little bit hard to see the difference. So we have a special mat that you stand on, and we can actually measure the distance between the legs. So we keep your feet in the same place, and you can see the distance between the legs. The inner thighs is a little bit more. So this was after 1 session. Same thing here. I'm looking at the distance between the thighs. This was after 1 session. From the back too, you can see kind of this person had inner and outer thighs treated. So kind of this fullness on the lateral thigh does really well. We have flat applicators when we do the legs. All the other ones are suction, but when we do inner and outer thighs, we have a flat applicator. And then the banana roll, or this area under the buttock, a lot of women can be bothered by that. So it does a nice job of treating that. And then once again, the flanks for the love handle region. And looking at, once again, this patient had, 1 session, and this was six years after his Coolsculpting treatment. So showing that the results are still there. So I'm sure all of you are wondering, this sounds too good to be true. So what is the cost? So because we have this All About Me, the small applicators, or all the applicators except the really large one, are $600. They're normally $750. And then the large one, or the max, which we use in the abdomen, if you're a candidate, that's $1,200, and it's normally $1,500. We do offer the treatments at main campus. We have two machines there. So we're able to dual sculpt, for example, do, love handles at the same time, or inner and outer thighs at the same time. And then at Avon, our Richard E. Jacobs Center, we do have 1 device there. So it's really a great treatment. I'm sure a lot of you have heard about it in the press. It's been featured on a lot of different TV shows, magazines. It's a great treatment. And I think it can really help with any of this recent COVID weight loss most of us have experienced. So with that, I hope you found this helpful, and I'd be happy to take any questions.
Will exercise help enhance the results and reduce loose and saggy skin?
It's best to do the treatment when you're at your target weight, whatever that is. So, I encourage my patients to do diet and exercise first, get to their target weight, and then consider Coolsculpting. And in terms of the sagging skin, I think every person is a little bit different in terms of what they look like. So at the consultation, that's something that we will discuss if we feel like there is going to be a little bit of loose skin, or, what each person's circumstances are. That's certainly something we can discuss at a consultation, but it's a little bit hard to answer because each person is so different.
Speaking to the fact that each person is a little bit different, is there a good candidate? We did have a question about being overweight, and would being 30 pounds overweight be too much?
We typically say that this is going to do best if you're, kind of at your ideal body weight with a normal BMI. So let me put it this way. I have treated patients who, may not be in that target BMI. It just requires more sessions to get to your goals. So, if the goals are just to have a little bit improvement, better contour, that's certainly reasonable. But if someone is planning on losing weight, I think it's best to do that first, then consider Coolsculpting. But it can certainly be done if you're not at your target weight. It just may require more sessions.
What's the best way to schedule a consultation?
So we have a cosmetic concierge, and Brianna, maybe we can share this number with everyone afterwards, or it's our cosmetic concierge can schedule consultations. For those of you who are listening now, that number is pretty easy to remember. It's 216-444-4004. And pretty much most of our locations, we can do the consultation. Majority of people, we do not offer the treatment the day of consultation, just because it does take some time in scheduling. So a lot of times, the summer, people are wearing bathing suits, things like that. We will, you can do it whenever, but given that there's a little bit of swelling, a lot of people may opt not to do it right away. But typically we see you for the consult, and then we'll schedule you for your treatment that day for a time in the future. But we do take
Great,
photos. We
thanks.
have a professional photographer who takes photos. So we do markings, we take photos, and it's usually, less than 30 minutes for the consult.
We have another question that says, can we do this treatment now? And by now, they mean during COVID.
Absolutely. So, the clinic is doing a great job with, taking extra precautions. So, we all wear a mask. All our patients wear a mask. Even if unless you're treating the chin region, that would be the only time we'd have to maybe move the mask. But yes, this is absolutely something that can be done. We sanitize everything between patients. And, typically when you come for Coolsculpting, it'll just be you and the provider in the room. There's not other people there. So, we try and keep our masks on and take all the proper precautions to keep everyone safe.
And would you also discuss the difference between Coolsculpting and Kybella treatment?
Absolutely. So Kybella is an injectable that is FDA approved for the chin only. So it's an injectable that we inject the submental region of the chin. With Kybella, it basically is a agent that dissolves your fat cells. So with Kybella, we're treating very, very small areas of skin, like the chin. With Coolsculpting, we're using a different technology. There's no injection involved, but we're using an applicator to freeze the fat. So both are permanent ways to destroy the fat. Typically, I prefer Coolsculpting for the chin. However, if someone doesn't have enough fullness, or if the applicator won't fit on their chin just based on their anatomy, then we will discuss Kybella and offer that as an option. They both are great treatments, but Kybella is limited only to the chin region, and then Coolsculpting we can do elsewhere. So yeah, I encourage anyone, we all have time held in our schedules to accommodate, consultations, things like that. So if you're interested, now is a great time to do it because it's a huge way to save. We are also very fortunate that we have some of the newer machines. When Coolsculpting first came out in 2010, they had their original set of Coolsculpting machines and applicators. So we have the newer versions, which are the Advantage ones, which are better results, faster treatments, and just overall improved. So we are very fortunate to have those. So if you're thinking about it, please come and see us for a consultation. There are free consults. There's no charge for those. We can see if you're a candidate. And if you are, it's certainly a good time to do your treatment and save.
The next question is, how many treatments for the abdominal treatment?
So every person is different. That is something we discuss at your consultation. Assuming your, normal BMI, and, I would say average is 2 to 3 sessions, but it does vary person to person. So that is something we would discuss. We have ways we can gauge approximately how many treatments you might need. So that is something we would discuss at the consultation.
Great, thank you. And then what is the difference between Coolsculpting and liposuction?
So Coolsculpting is truly non-invasive. We're applicators on the skin. There's no downtime. There's no anesthesia. With liposuction, there are incisions made in the skin and the area is numbed with an anesthetic, and then fat is manually removed. So certainly, liposuction is a surgery. It's a procedure. There are risks, obviously, with any kind of surgery, like anesthesia, infection, bleeding, all of that. However, one of the pros of liposuction is you can take away much more fat. However, it is surgery and that carries its own risk. Coolsculpting is totally non-invasive.
Great, thank you. But we do offer both at the Cleveland Clinic, correct?
Yes, our plastic surgeons do liposuction. So, if you, maybe looking at the photos, feel like you have a little more fullness, or it's something you don't want to come back multiple times to have it done, liposuction is certainly an option. There are also some areas that we are not able to do Coolsculpting on that liposuction can be done on. So at your consultation, we can kind of guide you as to what you might do best with and maybe what the most cost-effective option is.
They heard that you can get a hard area where treated, and I guess this is after you've used the treatment. Is this true?
So you can sometimes get a little bit of, there's a little bit of inflammation in the fat where you can get a kind of a harder area. Majority of those little nodules will go away in 2 to 4 weeks. So that can temporarily happen. However, long-term, I have not seen that happen if it's done correctly.
And then what is the cost for a consultation?
So during All About Me, I believe all of our consult fees are waived. Outside of All About Me, it is an $85 consultation fee.
Is this part of Brilliant Distinctions? If so, are the discounts available at the clinic?
Yes, this is a part of Brilliant Distinctions. It is an allergen company and treatment. So you do get points for that. And, if they have any specials or things going on, you can, refer to your Brilliant Distinctions account and then just bring any vouchers or things you have to your appointment. That way we can apply them and give you, use those points.
Are these discounts available only for employees or for anyone on the EHP?
Oh, sure. So, the right now the All About Me is offered to everyone. The pricing, the discounted pricing is offered to employees all the time, not just during this time. So, we are not combining discounts. So the price that I discussed is the same for employees year round or for those who are not employees during this All About Me event.
This is not covered by insurance.
Right. However, I do believe people can use their like flex spending like FSA or HSA for these treatments.
What is the actual cost of a procedure?
So we go by applicator. So as I showed you before, there were several different applicators depending on your anatomy and how many, how things like what your goals are, what areas you want to treat. So each of the small applicators is $600. And then the large one that's for the abdomen only is $1,200. So we would, at the consultation, you would let me know like what your target areas are, and then we could see what would fit best. We actually have little things we used to draw on your skin and see which ones would target the fullness and the fat in the best way.
I know, Dr. Khetarpal, you did say that we are accepting consultations and appointments for Coolsculpting, but I also know that you personally have a pretty booked schedule. Your APP does have availability for Coolsculpting consultations, though, correct?
Yes. So, I have some availability to see patients. I also have a PA that works with me, Evelina. I have trained her extensively, and she is actually the one who does the treatment. So there are many of us in our practice who would be happy to see you, not just myself. So when you call Martha, who's our cosmetic concierge scheduler, she'll make sure that she gets you scheduled with, someone who is trained to do an evaluation and go over the treatment with you.
So for anyone, the patient who was having trouble getting scheduled, give Martha a call again. And then does the cost of consultation become applied to the final service?
So, right now we are waiving consult fees, but I will tell you, each provider is a little bit different. For my patients who myself and Evelina see for Coolsculpting, we do apply your consult fee to the cost of the Coolsculpting.
What areas are not good for this treatment?
Areas like the breast in women, we don't want to go near the breast tissue. Around the knee can be a little bit challenging in the lower leg. Aside from the chin, we don't recommend other areas of the face. On the arms, outer arms don't tend to do as well as inner arms. We avoid breast area. Pretty much all the areas that we can do with liposuction, generally you can do with Coolsculpting. If there's specific areas, that people have in mind, I'm happy to answer that. But let me put it this way. I don't think someone's ever come in, for an area that we weren't able to treat with Coolsculpting. So, most of the areas I showed before, those are all pretty common areas where people accumulate fat. So the neck and things like that, if you're not talking about the chin, those can be challenging. But for the most part, we're able to fit the applicators on a lot of areas.
We do have another question. Do EEs, and I believe you mean employees, get a discount any other time of the year?
So employees always get a discount off of the standard price, not the special event pricing. So all of our aesthetic treatments are 20% off for employees all the time, whether it's Coolsculpting or other lasers, injectables, services our estheticians offer. Employees always get a discount.
The specific area that we had a patient wondering about was the inner knee between the legs.
So that would depend on the person. I have treated the inner knee before, but there are other considerations. For example, sometimes there's muscle, sometimes there's other things there that are not just fat. So we could certainly look and evaluate and determine if they would be a candidate. Ironically, the same applicator we use in the chin can sometimes fit on the knee.
Can the fat come back after the procedure?
No. So once the fat cells are gone, they are permanently gone. However, it doesn't remove all the fat cells. So if you were to gain weight down the road, the existing fat cells could get larger and could be fuller. But once the fat cells are removed with Coolsculpting, they are permanently gone.
Thank you so much, Dr. Khetarpal, for taking the time to engage with our patients and give us insight into Coolsculpting. Thank you and have a great day.
Thank you.